Hi, I'm Stephanie and I'm Eli's mom.
Hi, I'm Brianna and I'm Nicholas and Maddox's mom.
Hi, I'm Marcia.
Hi, my name is Cheryl. Thank you for coming. Today we're going to be talking about retinoblastoma, which is cancer of the eye. It affects children from infancy to 5 years old usually. 10 years ago, I saw a newscast in West Palm Beach on a little boy named Joey Bergsma who died of retinoblastoma at the age of 3. What I did learn about this show was that you can take a picture of the tumor and not even know it. In 2002, I was going through a bunch of pictures and I found 11 photographs of Alexis Paul, a little girl age 2, and I took 11 photos of the tumor in her right eye. There's 3 things that we're going to cover today. A brief history of retinoblastoma, looking at your photographs and what to look for in your children, and the prevention of it. 1 in 4 children every year born in the United States are born with some type of an eye disease. 1 in 15,000 children every year born in the United States have retinoblastoma. What retinoblastoma is it's a tumor that's behind the retina in the eye. And it's very hard to see it. You have to go back into the eye ground to see it. There's 2 types of retinoblastoma. One is hereditary or familial, where it's passed on with the RB1 gene. I don't know if any of you watched Jeopardy or ever have, but a few years ago there was a contestant on there, Eddie Timanis, and he was a 5-time Jeopardy winner. I had the privilege of meeting him. He's totally blind from retinoblastoma. His father passed the gene on to him. They had children and they passed the gene on to their son. Their son was able to be cured from it because they knew ahead of time. The second type is non-familial or non-hereditary. It affects just one eye. I don't know if you know who Peter Falk is from Colombo. He had retinoblastoma and he had his eye removed in a prosthetic eye. Either way, undetected, the disease is devastating and sometimes fatal. Caught early, they can use cryosurgery to freeze it off. They can use thermal ablation for heat. Sometimes they have to take the eye, which is eye enucleation, chemotherapy, or a combination of those. Of all the cancer in kids, this is the one that's the most curable. No child needs to die from this disease. So what can you do at home? Take pictures. Look at your pictures. This is a perfect example of the pictures. This is a picture that I took. And this is the tumor reflecting the flash. You can see it in her right eye. Those red eye photos, the ones that you get so mad about, want to throw away, look at them because you can take a picture of this tumor. If you see a white dot in a red eye photo, this could indicate the tumor reflecting the flash. Other things to think about, of all the parents that have children with retinoblastoma, 60% of them say they have white dot photos. So look at your pictures. Also, other signs to look for is where the eye turns inward, which is called strabismus, watery, red, itchy eyes, a droopy eye. If your child can speak, they'll let you know that they've got maybe pain, headache, something behind the eye that hurts. So take a picture of your child, take several pictures of your child in a low lit room that requires a flash. Look at them. If you see a white dot where there should be a red dot, take the picture of your child to a doctor. So the prevention, what can we do to prevent this? This is an ophthalmoscope. This is used at the doctor's office, and if it's not, then it needs to be. It's called the stethoscope for the eyes. Every time you see a stethoscope come out, make sure that your doctor brings out the ophthalmoscope. What this does is it looks back behind the retina like nothing else can do, and it can detect tumor or some other eye disease. In infants, they need eye dilation drops because their pupils are so tiny. This needs to be done at 0 to 2 weeks. Usually they'll do it in the hospital. 6 to 8 weeks at their exam, and then at 6 to 9 months. After that, they don't need the dilation drops, but always the ophthalmoscope. That's not the thing that goes in the ear, it's the thing that looks behind the eye. The ophthalmoscope, and the other thing that's very important is they have to turn the lights out in the room. It has to be a dark room. In an infant, call it the 2-cent 15-second test. They need to look in their eyes for 15 seconds. If a doctor put a stethoscope up to your heart and listened to 1 heartbeat, you couldn't tell that there's a murmur. So anyway, if the doctor doesn't do this, demand this test. It's really, really important. So remember, look at your photos. If you see a white dot picture where there should be a red eye picture, take the picture and your child to the doctor. At every eye screening exam, make sure they use the ophthalmoscope and shut the lights out. If it's a baby, eye dilation drops. Retinoblastoma is the most curable cancer in children. If caught early. If not, it can be devastating or fatal. I know because the picture that I took, all the pictures that I took in 2002 were of my granddaughter. Had I not taken those pictures, I would have never known that there was a tumor.